The number of confirmed COVID-19 cases in Africa has topped 3 million, with the death toll from the disease exceeding 72,000. According to the Africa Centers for Disease Control and Prevention, almost 2.5 million people have recovered from COVID-19 infections across the continent. Well, the most affected African countries in terms of the number of positive cases include South Africa, Morocco, Egypt, Tunisia, and Ethiopia. South Africa has also reported the highest COVID-19 inflicted deaths in Africa, with nearly 33,000 recorded deaths.
And here in Nigeria, where the country has now officially surpassed 100,000 confirmed cases of the coronavirus. According to the latest statistics from the National Center of Disease Control, it has recorded 1,024 new cases of the virus in the past 24 hours, with 653 of them in Lagos State alone. So far, in total, 80,030 have been discharged and 1,358 have died with the virus. The news comes as concerns grow over the surge of the second wave the country is currently experiencing.
The Nigerian Medical Association has warned that the daily record of COVID-19 cases is not reflective of the total number of infected persons in the country. According to the chairman of the Lagos State branch of the Nigerian Medical Association, Dr. Adetunji Adenekon, the figures released by the Nigeria Center for Disease Control and CDC daily were only based on the number of tests conducted. He noted that cases had continued to rise because of disregard for the safety protocols and urged Nigerians to adhere to safety protocols and also present themselves for testing.
The Ekiti State Government has imposed an indefinite night curfew and a ban on large crowds in the state to check the spread of COVID-19. The government said the curfew would take effect from Monday, January 11th, that's today, and would be from 8 p.m. to 6 a.m. For more on this, we cross live now to Ado Ekiti, where the Ekiti Commissioner of Health, Dr. Oyebanji Filani, joins us now. Good to have you, sir, on Newsday. Now, we hear you're taking the bold step of imposing a curfew and limiting the number of people gathering in public places to about 20. Why have you decided to take that step now?
Thank you very much, first and foremost, for having me, and good day to the viewers as well. I think I'll speak on the second point which you made, which is in terms of the number of people in a gathering at any point in time. It's very clear that globally we're now in the second wave, but also more importantly, just as you narrated earlier on, that even in Nigeria, we're seeing the second wave. Ours is largely preventive to ensure that we minimize the potential increase in cases. With respect to what we call what is being called the curfew, we've always actually had that in place. And in the broadcast made by His Excellency, the Governor, just before Christmas, it was also mentioned. However, what we just did not use was the word called curfew. We've always said that nothing should happen between 8 p.m. and 6 a.m. in the morning, between 8 p.m. in the evening and 6 a.m. in the morning. But what we found out is because we didn't use the word curfew, there were still a number of people flouting that rule. And on that basis, we decided, okay, it might as well be useful to bring in the word now. So it's always been in place. It's just that we've just changed the semantics around it.
You just named it. Okay.
Exactly.
Yeah, beautiful. What other measures are you taking to curb the spread of this virus in Ekiti State?
We're throwing almost everything at it. And by everything, I mean starting from the preventive parts of it. We're ensuring that we're constantly on radio with jingles, providing the necessary IAC materials and reaching out to the communities in different forms to ensure that people are aware, but also take necessary preventive precautions necessary to ensure that they don't have it. So that's on one hand. On the second hand is that, so that's on the preventive hand. On the second hand is that we're ensuring that we can expand very rapidly our testing and ramp up ability to test as many people as possible. Just last week, we partnered with a private sector organization to increase the capacity for testing by 1,500%. And thirdly, it's just making sure that for those who then they have the opportunity to be able to get quick treatment. In all of this, I must say that the government, led by His Excellency, has made strong commitment to the state, not just from a resource perspective, but also from an engagement perspective. He's been very involved. and making sure that we can speak to the matter as and when necessary.
Okay, Commissioner, I'm just looking at the figures now, and please correct me if they're not accurate, but you currently come down at 438 cases and 7 deaths. Some would say that you're not the worst hit by COVID-19, so why are you having to ramp things up? I know you said it's largely preventative, but is there anything else that is informing this response?
So yes, you're correct. Just slightly, as at this morning, 443 persons have been tested positive for COVID-19 in Ekiti State. For us, it's better to, take these bold measures now than, which is eventually is cheaper, right, for everyone. It's cheaper for people who live in Ekiti. It's cheaper for the government. It's cheaper for the system, right, than having people fall ill and needing significant care. We want to maintain what we've always done, which is to be proactive, and which was what has led to us having this limited number of cases from the very beginning. So it's this proactive nature that we've taken from the ground up, or from the very beginning, that's also helped us, and that's what we're continuing to do.
Well, Doctor, it takes two to tango, really. Government on the one hand with their policies, but how are the people of Ekiti State responding to all these your policies on curbing the spread of COVID-19?
It's an interesting question. We carried out a survey about 4 weeks ago just to get a sense of what people thought. And a couple of things stood out. One was, which is not unique to Ekiti, is people were concerned about if the virus was still with us as a nation or in the world, right? The second was the concerns about, the comfortability of the masks that is being used. And we're trying to address all this because we consider them important to ensure that we continue to improve continue to prevent this disease. The second thing is that it's an engagement, which is what you've rightly mentioned, right? So there's a role for government, but there are other stakeholders in place who people in Ekiti listen to. We have the religious institutions, for instance. We have the churches and all the other places. So we engage them as well to make sure that they can also speak the same language. I think also more importantly is that people who have now had are coming out here in Ekiti and saying, look, I've had this ailment. It is real. It has implications. And so I would ensure that you avoid it. So those are things that we're putting in place, making sure that there are a number of people who are speaking to the same issue and ensuring that we have that. I think secondly is also then what we're doing to support, right? We've distributed masks here in the States for people. We're ensuring that our tests in Ekiti State are free, except, of course, if you decide to use it because you want to travel. But for everybody who meets the case definition here in Ekiti, the test is free. So those are some of the things that we're putting in place to ensure that citizens there. But I must say that even with all of this, there's still a responsibility that citizens have to protect themselves. And I use this medium to reach out to everyone that COVID is real and it continues to be real, that the implications can be profound if you're one of the 3 or 4 who have the negative ailment. And more importantly is that even if your symptoms are not as bad, you never know whose symptoms are as bad. So as good as it may be for you, you have a responsibility to the second person or to the person beside you to ensure that you wear your mask appropriately and you wash your hands and maintain all other preventive measures.
Okay, Commissioner, we have to commend your engagement policy or outlook. However, I want to go back to the 20 people gathering in public places and try and get a sense of how the logistics will play out. So, for example, in a marketplace, how do you intend to restrict gatherings in places like that?
So, thanks. First of all, with market is an open, more often than not, is always an open environment, right? So the risk of having that is lower than if you're in an enclosed space. And so for the 20 is really more about the enclosed spaces. We recognize that people will still need to go to stores to buy food or buy household commodities. We recognize that people will still need to meet. But if you limit the number of people within an environment, then you limit the risk of having of transmitting the ailment. So for us, it's a step in the next direction. Initially, we were at 50, but now with the rising cases nationally, and we're seeing the needle move slowly in Ekiti, we think that's also important that we take a proactive measure, hence the 20. So it speaks more to those who are in an enclosed space rather than in markets.
Dr. Oyebanji, let's talk about the issue of monitoring. Monitoring is key if you're going to get the desired results. So is there strict monitoring of those protocols? That's one. And then what deterrents are in place for people who falter? You talked particularly about enclosed places. You do that briefly.
So thanks. We have a task force whose role and responsibility is to ensure that we're able to adequately monitor what goes on across the state. In December, around the Christmas period, I'm aware that we had to close down 2 or 3 institutions who had flouted the law that we put down at that point. Now that the governor again has come out just yesterday to further reiterate the preventive measures in place, the task force will continue to be active and ensure that we can, if necessary, you close down, right? That's the punitive measure. And where we think that someone has gone beyond the rule, if necessary, then we may need to charge such organization or institution to court.
All right, thank you so much, Dr. Oyebanji Filani, Commissioner of Health, Ekiti State.